The COVID-19 pandemic is a complex global public health crisis presenting clinical challenges and impacting on different sectors. There is currently no cure for COVID-19. And the aim of treatment is to manage and reduce symptoms until the patient recovers. A proportion of people who contract COVID-19 will require hospital care, even as Nigeria struggles with an oxygen crisis. Managing COVID-19 patients can be stressful, and it can indeed be a long road to recovery for many of the patients. Joining me to discuss recovery and management of COVID-19 is the first Vice President, West African College of Nurses, Shola Aketi. Good morning. Thank you for joining us. And also joining us via Skype is epidemiologist and member, Association of Public Health Physicians of Nigeria, Lagos Chapter, Dr. Oladapo Ashiyombi. Thank you for joining us.
Good morning, Nigeria.
Thank you very much. Now, before we get into management, like understanding or getting to know one's HIV status, a lot of Nigerians are really scared with when they hear about perhaps know your status with regards to the virus, go for testing. It seems to send cold shivers down their spine. I want us to begin from that point. What do you make of this? I'm speaking with you, Dr. Ashiyombi.
Okay. All right. Thank you. Well, for any disease, especially something like an epidemic or pandemic, the first step is to confirm people who have the disease or who have the condition. You cannot treat anyone if you don't know the person's status as regards to the disease. So I want to use this medium to encourage Nigerians, even though we're in the second wave, there is not much to be afraid of. Majority of people who will get COVID, because we have a very young population, are going to be asymptomatic. By that, they will not have symptoms, or even if they do, it will be mild. And that's why most people who start it will tell you they have malaria-like symptoms. They have a fever, you have a dry cough, you have body pains, and so everybody treats malaria first. So that's what will happen to most people. However, because we have a very large population in Nigeria, which is over 200 million, and about 5% of the population are going to be elderly, who the virus will affect more. So that we're looking at about 10 million people who are likely going to be affected more. And if 10 million people are going to be affected more, only about 2 to 3% of that, which comes to less than 2 million, will be the ones that we need to deal with when it comes to severe disease, needing oxygen, needing ICU, and may unfortunately pass on. And therefore, we would have missed a lot of people because people expect the elderly to be the one to pass on to the great beyond. And so there's not much to say. We will say, well, it's an older person. Who else do you expect to die? And then we will celebrate, we will gather. By gathering, we are not putting others at risk. So I want to encourage us that 2 million is a lot. The health system cannot cope. So the earlier everybody tries to get a test, and the earlier we're able to make the test more accessible and cheaper for Nigerians, the better for the response.
All right. Now, let's bring it to the studio now, the conversation to the studio. He mentioned something about management, not being able to cope the way we are going if we don't ensure testing is accessible and perhaps affordable for a lot of Nigerians, because you would recall the PTF talking about with the way things are going. When the cases become severe and the numbers keep rising, the hospitals may not be able to manage the numbers at the end of the day. Now, let's begin to look into the aspects of management. When you get the symptoms, when you see whatever signs that you will be talking to us about, how do we manage this? Perhaps the non-clinical measures to take.
Thank you very much. Good morning once again. It's a privilege I'm here.
Yes.
And Happy New Year.
Same to you.
I'll start by telling us that we have a lot of super spreader out there.
Right.
Who are these super spreader? Asymptomatic. And we get these asymptomatic clients from our resumed activities. Of recent, you saw that nightclub that was locked down,
Yes.
and how many young ones that came out. No mask, no protocol being observed. That alone is enough to tell us where we find ourselves in this society. We place pleasure at the expense of our health. Majority of those people that are dying of recent is because of other comorbidity they have, some of which did not subject themselves to tests to have identified that they have this problem.
Right. So
Majority of
testing is key.
Nigerians, yes, majority of Nigerians are going about with so many challenges. It doesn't matter, I'll go over it.
I'll
You know
manage it. Yeah.
the way we do take things. And like I keep saying, you don't devise a man from his cultural base. So we are full of so many things, such as, oh, we have our roots there. You can get this and that. So many misconceptions and myths, they are outside there. What we need to do, I keep saying, is advocacy, more of advocacy, more of advocacy.
That's what the PTF have been doing.
We need to do more than that.
Right.
We need to get to the nook and crannies of our facilities, of our societies, to let them know that this is the real thing. And like I said, you should be a transformational leader. Whatever you are saying, you should be able to talk it.
Right.
I
Leading
saw
from the
something
front.
now.
Yes.
I saw something now in your presentation. Somebody was putting on mask. Only the mouth, leaving the nose. So if he sneezes, the people around him or her is not safe. It starts from there. It starts from, say, some of those soldiers were saying something. But I want to believe that we should be more proactive than that, because they are soldiers. So also the medical personnel, they are soldiers. Attention should be given to them now, because we have enabled them to know, come to us in the hospitals or our facilities, we give it to you the necessary care. So the individual confidence should be built. And how do you do that? By ensuring that the soldiers on the field are not neglected. Thank God for Lagos State. I must tell you this. They are always taking the lead in all this. So in terms of treatment, our people's belief in terms of treatment should be looked into, that, oh, you don't just take, because so many things are on the pages now. Oh, if you take vitamin C, take vitamin D, it's beyond that.
Right.
It's about assessing yourself first to have identify what you have, to enable you know how to intervene. If you don't know what you have, you won't be able to intervene,
know how to intervene.
accordingly.
Yes.
Accordingly. Again, between January and today, January 1st and today, we have lost over 220 people in Lagos State, for instance. Over 1,500 death cases reported. It's challenging. We are not in a tsunami to have having this kind of death. Do you know what it takes? In sovereign society, the death of one is the concern of all. So how much more people that are healthy, that are productive, they are dying like that, is a means of concern. But I have to contribute to it as well. To what extent have I been able to keep to the protocol? In Australia, they were able to reduce these indices because of the facial mask. Legitimate, put it as a legitimate factor. That if you don't come out with it, you'll be sanctioned. They place it here, but what happened? Politics of the day. Social gathering. You remember recently we lost some intellectuals.
Right.
Because of what?
Social gathering.
Must I go? Must I attend? Can't I do it virtual? Hybrid. But rather, no. A majority of our elderly, like in California now, they are having a rate of death rate because majority of them are elderly and they don't keep to protocols. But now they are coming back, they are shedding their soul to come back and ensure that they keep to those protocols. So also we should also look at treatment-wise. You come to the center, you be told or what to do, you go back to the communities and maintain it. For instance, we are already in Lagos State, we're already in the community by telling people, because we find out that at a time we come, we'll not be able to have enough space for these affected cases.
Right.
And so it's only few isolation centers that are still operational, because workforce need to be considered as well. And that's why people should know what to do. So if you want to live healthy, want to prolong your life, please maintain this social distancing, washing of hands, masking yourself, just those are precautionary measures that will make you to live long. And there's something we call long COVID symptoms. For the fact that you are proven to be negative does not mean you will not be having the symptoms. Having those symptoms might not confirm that you are positive, but it's about extending those symptoms more than about up to 6 months sometimes. But that doesn't mean you are positive, and you still have to protect yourself. And there are some that are they're already affected, in which their organs, hearts, whatever, have been affected. What do you do to these people? You keep them under continuous check by giving them an appointment, ensuring that they carry out the necessary investigations. COVID has come to destabilize the lifestyle we have already established before, but we need to find an adjustable system in which we have to progressively live our life without being injured in any way.
All right, let's take the conversation back to Dr. Ashiyombi via Skype now. The symptoms vary from one person to the other, and management is also varies with the symptoms. Talk to us from this point of view, how persons perhaps could manage the symptoms, seeing that we are having an overstretched facility as we speak.
Thank you very much. Well, the commonest symptoms are 1, cough, dry cough that doesn't produce sputum, fever, difficulty in breathing. Those 3 are the commonest symptoms. Then you have people who have body pains, who have loss of smell, loss of taste. Then you have people who have other symptoms, like children. Some children have come up with rash. It's very common. Some come up with abdominal pain. Now, if you have any of these, the most common ones I've talked about are those ones that make you feel as if you have malaria. So many people who think they have malaria now, and then they take malaria drugs or drugs for typhoid. If it is not working within 2 days, please go take a COVID test yourself. When you take the test, most people, when they now take the test and they're positive, please don't resort to home treatment or just going to the chemist to go and buy azithromycin, zinc, vitamin C, and various things that are being peddled on social media to make people feel that is the cure. No. Majority of people will have no symptoms and their immunity will be good enough to deal with it. But if you start having difficulty in breathing, please immediately go on to any of the isolation centers, the treatment centers approved by government. Because within minutes, that can take a turn for the worse. And oxygen is essential in that situation. So if you are not having the oxygen, you might just pass away. So what to take away, please, the commonest symptoms are what deals with fever, difficulty in breathing, dry cough, and body pain. Please don't treat at home. Don't believe all those things that they peddle on social media. Evidence has shown, because we have learned more. In the early days, we thought those things worked. That is January, February, March, April, May. But by June, July, August, research has shown that those things don't work. You need to check yourself in if you cannot manage. But the rest who are positive, who are either asymptomatic or slightly symptomatic and don't need support, please stay at home. You get home-based care. Call any of the COVID helplines. You will not get health workers who will follow you up every day until you repeat the test and you are negative and you can join the society back. Thank you.
All right. Back in the studio now, you mentioned something, talked about after perhaps treatment, the impact on some of the organs, and some persons beyond even the impact on the organs psychologically.
Yeah.
Some people feel they are stigmatized and all of that. How do we begin to deal with that?
Thank you. I will say by saying this, that we have come to a level whereby you have to be a physician of yourself and your immediate environment. I'm serious. A case in question came around December 25th. This fellow did not know is a super spreader. But the family was subjected because they needed to travel out for holiday. And they found out that all of them are positive. In Nigeria, they are not positive. But when they get over there, they confirm they are positive. Positive. Possible. We did this before leaving. Thus, they were quarantined or kept isolated for about 14 days. They needed to make a call home. Please, they inform the remaining people in the family, please ensure that everybody check themselves, only to find out that the husband too is positive. The moment the man got to know he is positive, high-ranking person, he just went into berserk. He could not communicate. He started behaving funny. And the family are not there. It's only the helpers and whatever that are available. So extended family has to come in and see what they can do. What do I bring you to bear is COVID-19 presents in a very funny way. The first 3 symptoms or 4 symptoms just mentioned by Dr. Ashinyobi, yeah, true. But by the time you're having malaise, you're having mental distortion. Depression of any sort is also a cause for concern, in which everybody should walk up towards and see that physically and mentally, an individual is being protected. What do you need to do? Call in the specialists, because this is a multi-layer factors now.
Right.
Everybody will say, oh, if you have this, it's beyond that. During the active stage, we can say that. But like we can identify, it has gone beyond that, affecting organs, affecting the brain, causing brain fog, and display of all this mental distortion. Also causing general malaise, like he said. And when you are general malaise, you can't do anything. It's also a sign of inflammation, early sign of inflammation. But this has to be distinct, that this is more of COVID. COVID, like I said, once it affects one organ, any other associated organ is at risk. And that's why you have to subject yourself to the specialist. Thank God for the availability of call line. You can call and let them. This is a country where we don't make use of what we have. Sometimes they say, I've been calling that line, it doesn't work. It doesn't stop you from trying again.
Right.
You call and call because you don't know how many people are on that line. You keep calling. And that's why this nail should be looked into, man. I must tell you. We are trying to curb something, and the social gathering is still there. Outside there, yesterday, at this NCDC, I saw how many people were queuing up in order to get themselves the nail. At the end of the day, we are still going to have the spike. The border is now open because we need to boost our economy.
Right.
Truly, the government has done the right thing. But what happened? We misused the opportunity of the opening of the borders. And so all this needs to be put into consideration that treatment-wise, when I'm receiving treatment, how about the people that I'm relating with thereafter? How about the people that I'm coming across with? How about the people that are coming to me without knowing that they are the one infecting me? So there's something we call herd immunity. Herd immunity it's also called social immunity or community immunity, where if I'm able to build my immunity, it's at about 50 to 70% of such in the community. But for this COVID, I must of necessity tell you, it has to be up to 70 plus. That I have an immunity to combat this COVID-19, fine. But vaccination is another medium through which it will improve the immunity in the community, which we are yet to get to a final stage anyway. So with this herd immunity, we enable us to lower the rate of this infection. Where that is not practicable, we find it as a challenging issue. So we should try as much as possible to keep to this social distancing, washing of hands.
Safety protocols.
Yes, basically. Those safety protocols will help up the more, and individuals should also build their immunity. Where you are
which is the question I'd like to throw to Dr. Ashinyobi. How can people build their immunity at this time?
Okay.
Thank you very much. I need us to, first of all, take this information very seriously. It's a wrong notion for people to say, I want to build my immunity.
Right.
It's a wrong notion that you take a drug or you take some fruit and immediately your immunity is boosted and then you become a superhuman. Please, immunity has a lot of factors. Not just drugs, not just food, sleep, even how you think, even what you do, even what you don't take. So it's a long-term thing. It's not something that you can build with taking some drugs or some fruits. No, they help, but the only thing, immunity has many things that surround it at the cellular level, at the organ level, at the social level. So we must understand that it is not take this drug and no. Please just eat well, sleep well. Don't get yourself exposed. It's let me try and explain that a bit. Now, if you have 1 million copies of the virus around you, now if you go to a gathering and there are 1,000 people, then it becomes 10 million. Even if you have good immunity, the chances are that the dose will overwhelm your immune system. So you see, there are a lot of, so immunity is a factor of you, the person, then the virus or the agent, and the environment. So you see, it's three things that co-work together and interplay. So please, don't say, please prescribe a drug to boost my immunity. No. Just eat well, sleep well, do the non-pharmaceutical intervention. Now, if vaccination comes, it will also help to teach your immune system how to fight the virus. So please open yourself up to get vaccinated when it is time. In addition to that, I want to say that maybe government might now need to rethink to improve the level of compliance with the non-pharmaceutical intervention, weighing that with the economic opening up. Because what you're having, anytime you open the economy up, meaning more people will intermingle. When more people intermingle, the virus spreads. The virus does not spread by itself. It is us that move it around. Now, it is a balance. Government may have to do more stringent, take more stringent actions to reduce our intermingling, ensure that public transport go back to compliance with must use a face mask, reduce the number of people they carry. We also need to reduce the opening and closing days of the market and places that are essential. And I hope that Nigerians will follow suit by doing their own part and take responsibility for their lives. Thank you.
Thank you, Dr. Ladakwa. That's a very fine place to live. It's taking responsibility for your life, which a lot of which the government has also been harping on, and leadership, which a lot of Nigerians have also been talking about. We must also thank you for Shola Aketi. She is the first Vice President of West African College of Nurses. Thank you so much for your time on the program as well.